And KNH CEO Lilly Koros' tenure at the helm of the country's largest referral hospital has had its fair share of good and bad, but perhaps more bad than good. Well, since she took office in 2014, the hospital has been in the spotlight for a number of unhealthy issues. Yesterday's rape allegations, which she denied but promised to investigate, are just the latest.
The latest outrage over reports of rape at the country's biggest referral hospital have put the facility's chief executive in quite an uncomfortable position. This was her attempt at a response to the allegations that birthing mothers cannot be assured of their safety even in the largest, most celebrated referral hospital in the country and region.
There is no mother or patient that has reported to have been raped or an attempted rape at Kenyatta National Hospital.
Her response to these sick claims infuriated a section of members of the public, more so what appears to be attempts to paint a cleaned-up image of the hospital.
Let's go to the wards. This is where the mothers' documents are. We have somebody who will tell us whether they are mothers who are staying.
But a number of women MPs on a fact-finding beat at the hospital uncovered some unpolished truths.
Something that Honorable Passaris had shared earlier about detaining patients who are already well and should be discharged. And secondly, we asked them why they come as a group, and they said they've ever been called and they were told to go as a group, or when you see a man in the lift, please don't enter. That means it is something that they are aware.
CEO Lilly Koros has been summoned by the Parliamentary Committee on Health to explain the allegations of rape at the facility. She is expected to give a report on the outcome of what the investigations have unearthed. She will also be expected to give a detailed status report of equipment at the hospital in the meeting that is scheduled for next week Friday. The hospital has been in the news for a number of right and sometimes wrong reasons. In October 2015, the hospital was the face of the ailing public health sector after a patient died at the facility after waiting 18 hours for ICU services. This incident reopening debate on the shortcomings of the country's public health sector. Health Cabinet Secretary Cleopa Mailu had also witnessed firsthand the state of affairs at the hospital when he, after being named CS, toured the facility unannounced.
What is failing the institution? And this I've discussed with the CEO is the issue of CSSD, sterilization, because the items they use in theatre after use must be sterilized so that they can be taken back to theatre. Their machines are broken down.
At any given time, we try to improve the quality of services that we are giving to our patients. However, sometimes we may not meet the expectations of the patients because of the constraint in terms of the numbers that we do receive.
A damning Ministry of Health internal audit of the hospital finances in the 2014-2015 and 2015-2016 financial years, and reported on extensively by the Business Daily, also revealed that the hospital lost millions of shillings in a series of fraudulent transactions that were dominated by illegal staff compensation and diversion of its funds at the parent ministry. The auditors said more money may have been lost through improper accounting and careless debt management. The CEO, Lilly Koros, said she was not aware of the ineligible allowances. Ms. Lilly Koros took office on the 24th of February 2014, taking over from Dr. Simeon Monda, who had been the acting CEO after the former CEO, Dr. Richard Lesiampe, left the hospital to serve as PS. Sheila Sendeo, NTV.